My name is Professor Adam Winstock. I'm a consultant psychiatrist, addiction medicine specialist, and founder of the Global Drug Survey. In this video, I'm going to talk about what investigations doctors might ask for once they've taken a history and done an examination. Now, without fail, the first sort of test a doctor might ask for is getting a blood test. Now, I know people aren't particularly keen on blood tests, but let's face it, it's a little prick. It hurts for about, 30 seconds. And then actually, it's a relatively painless procedure. If you're someone who doesn't have great veins, I actually understand that's maybe not always the case. But I think that there are really important investigations to go ahead with. And if you're someone who is quite frightened of needles, then remember that there are certain creams that we can put on your skin before the blood is done to actually take that pain away. And the other thing also to note is that people who take blood for a living, phlebotomists, are really good at what they do. They can use really tiny needles and actually make the whole process, I think, much more comfortable than people would ever envisage. Anyway, as a general rule, doctors are going to ask for 3 different sorts of blood tests if they're concerned about drinking. So the first thing is they're going to ask for a full blood count. So a full blood count looks at basically what's in your blood in terms of blood cells. So we've got red blood cells, white blood cells, and platelets. Red blood cells are the ones that contain hemoglobin, and they, have got carry oxygen around your body, and they're kind of super important. And from an alcohol point of view, what's important is how many red blood cells have you got? Because if you're someone who is drinking a lot, you might have a stomach ulcer, for example. And you might be losing blood, and therefore you might become anemic, which means you don't have enough red blood cells, and you might notice that you're very tired, for example, or you look a bit pale. And so in a full blood count, you can say there are less red blood cells, that person is anemic. But what they also do is they look at the size of the red blood cells. So if, for example, you've got a bleed like a stomach ulcer or something, you're losing blood and you're also losing iron. And we know that iron deficient anemia generally means you have tiny little red blood cells. But what you can also get if you drink too much is that your bone marrow, which is where lots of your blood cells are made, the way I think about it is that your bone marrow's got too much alcohol on board and it just can't be bothered to mature red blood cells from big flobby blood cells, which are called macrocytes, to kind of mature them into these tight little oxygen carrying powerhouses. And so people who drink a lot tend to have quite big red blood cells. Their mean corpuscular volume is big, and that can be quite a useful marker for someone drinking too much. If you drink too much, you can also suppress your bone marrow so you don't produce as many white blood cells. That's why people who drink too much seem to be more susceptible to getting infections. The other thing they look for is how many platelets have you got. Platelets are the tiny little sticky cells that when you cut yourself or there's a bleed, they all clump together to stop you bleeding. I mean, they're like super important. But if you drink a lot and your bone marrow is suppressed, you don't produce enough of those. And, below a certain level, doctors go, that's not great, and yes, it could be a marker that you're drinking. There is a threshold at which doctors will go, whoa, like if you cut yourself or you had an accident and you started bleeding, you wouldn't stop. And then they get kind of pretty anxious and they'll probably ask you to go to hospital. So the first thing we look at, full blood count, red cells, white cells, platelets. The next thing they tend to do is they ask for your liver function tests, which lots of people have heard about. So basically, your liver function tests are measuring the amount of enzymes that are released from your liver cells that are circulating around your blood. So basically, when a liver cell dies, it releases enzymes into your blood, and that's what you're measuring. And, our liver cells are dying all the time, and they're renewing, and so there are normal levels of these liver enzymes, and they're known by kind of 3 letters. There's AST, ALT, and the one for alcohol is GGT, gamma-glutamyl transferase. As you drink more and more, your liver cells get bigger. And as your liver cells get bigger and bigger, they eventually pop. And as they pop, they release more enzyme into the blood. That's what we measure. So when you have a liver test, they're seeing, have you got more enzymes floating around your blood? And if so, that could be a potential marker of liver cells dying. Now, not everyone who has got elevated markers, more enzymes, has got liver disease due to alcohol. Because you can get big increases in your liver enzymes if you're overweight, if you've got thyroid problems, if you've got viral hepatitis. There's other reasons. But there are particular patterns of increases that doctors will see as being more related to alcohol than other conditions. The other bit, though, that's pretty uncomfortable for many people is that just because your liver function tests are normal, that doesn't mean your liver's okay, and it doesn't mean that you can carry on drinking. That's actually one of the hardest things to feed back to patients. So I see patients who are drinking 100 standard drinks a day, and for some reason, their liver function tests don't come back elevated too badly. And they go, hey, I've got a great liver, this is fine. It's like, no. Liver enzyme tests are not so sensitive and specific that they'll always pick up liver disease related to alcohol. And of course, alcohol could be affecting you in other ways. There are a couple of other tests I'll just mention. There's something called CDT, or carbohydrate deficient transferase. That's a particularly useful marker for people who may be dependent. The other thing sometimes people look for is something called alkaline phosphatase and bilirubin. Bilirubin is the stuff that goes through the roof when you get jaundiced. It's what makes you look yellow. But the whole point is that a combination of those different liver function tests can give you some idea of what's going on. And what's really helpful is that if you're someone who has elevated liver function tests and you cut down your drinking, those liver function tests can be used to monitor the improvement in your liver health. And something like gamma-glutamyl transferase, GGT, that drops by 50% every 2 weeks when you stop drinking. And a lot of patients find it really useful to have some absolute number to demonstrate their improvement. But from a doctor's perspective, it's just another bit of information to figure out what is going on. The final set of blood tests that some doctors will look at is looking at clotting function. So one of the things that alcohol does is it stops the absorption of vitamin K from your gut. And vitamin K is really important in helping your blood clot. And if you're a heavy drinker and you're not absorbing enough vitamin K, you don't stop bleeding. And that can be a real problem. And so there are clotting function tests that basically in a bottle see how long does it take for your blood to clot. And they can be a really good marker for whether or not you're someone who's drinking too much and whether or not that needs to be corrected. They're the same sorts of blood tests that people do for people who are on warfarin who may have had a stroke or a DVT. What's really important is those baseline bloods taken in combination with a history and a physical assessment should give your doctor an overall picture of the impact that alcohol is having upon your health. In the next video, I want to talk about what do you need to know if you actually might be alcohol dependent, and what does that mean for the next steps in assessment and treatment.